Hi everyone, this is Jacqueline from Kinvey. Thank you for joining our webinar. Just a few housekeeping items before we get started. First, you can ask questions in the GoToWebinar panel, and we'll get to those at the end. And we will be recording this session, so we'll send out the link tomorrow so you can get the full replay as well. And with that, I'll hand it off to Niko from Redox.
Hi everybody, it's Niko from Redox here. I'm excited to chat with you today about a few different ways and means to integrate with electronic health records. This is the learning objectives that we're going to try to hit here, but the way that this webinar will go is I'll talk through generally how integration with EHRs from an application perspective could work and works in this modern API way. And then I'm going to hand it over to Jikku from Kinvey to start talking through some of the other aspects of deploying applications in the healthcare space around HIPAA and other concerns that are really unique in the way that we build apps in the healthcare world. So first and foremost, Redox is a platform for technology-enabled healthcare. We're an API platform, so integration is all we do. This is my contact info. I think we'll have it again later on, so if you're looking to reach out at all or want to tweet at us, go for it. But in general, over the past decade or so, we saw this first wave of technology adoption in healthcare, and that was really the adoption of electronic health records. So EHRs are really used in the 99% of hospitals around the country, and a smaller proportion, but definitely the wide majority of provider groups. The thing that really pushed electronic health records across the technology adoption chasm was meaningful use. The legislation brought about during the High-Tech Act, so part of that stimulus package back during the recession. But really that policy was focused on saying, let's see if we can get people to adopt technology because we think it'll improve efficiency. But it was really focused on that solution rather than the root cause of efficiency problems in the healthcare space. And years now after we've seen widespread adoption of the EHR, where really the verdict is still out on if they actually created efficiency gains. So a recent study from a few years back estimated that about a third of expenses in the healthcare part of our in the healthcare industry are waste. So $750 billion, and to put that in perspective, that's about as much as we spent on the war in Iraq up until that point. So I like to show this this pie chart because it's really a bullseye for entrepreneurs out there. Anyone who's building an application in healthcare is probably trying to tackle one of these areas, whether it's more efficiently delivering care, avoiding unnecessary services, trying to bring transparency into the space, trying to detect fraud early on. But each of these slivers, and even proportions of these slivers, 1% of this graph is a huge market that if your application can make a difference in, it's not only a huge market for you, but it's a huge amount of efficiency gains that you can bring into the industry. So I love this as that bullseye for this is why we need innovation and application development in the space. This amount of inefficiency has really driven a lot of the change in our industry lately, right? We're seeing this huge shift to value-based care where we're not only looking at how much things cost, but what are the outcomes. And the attempt here is to align the incentives around providers and hospitals and payers to figure out how to deliver care more effectively and more efficiently. And the reason why I want to dive into this value-based care paradigm is, this is where the industry is going. It puts the name of the game in healthcare on how do we do this efficiently and effectively. And when you talk about executing with efficiency, it's all about what technology do you use. And this shift towards value-based care is really driving this next wave of technology adoption in healthcare, and that's digital health. So these are the applications that we work with every day. It's why I love doing what we're doing at Redox, because we're able to talk to people building care coordination applications or advanced patient monitoring and patient engagement things, advanced analytics in the space, machine learning and all that sort of stuff. One of the challenges that we saw as we started talking to these applications over and over is that as they go to implement their software at the health systems around the country, they're essentially having to build customized point-to-point connections between their cloud-based application, which is the way that all pretty much all application development is done these days in a modern cloud-based environment, they have to connect that up to the health system who has an EHR in the basement in a data center controlled by that health system on-premise is the majority of the time. And if we take a step back and look across the industry of different digital health applications and the different hospitals and health systems that they're working with, there's this terrible web of inefficiency of each application, each health system building these point-to-point connections between their separate environments. That's the opportunity that we saw with Redox. So literally all we do, it's not rocket science, but it's solving this redundancy problem. So we're connecting up to each health system. We're standardizing to however that health system and that EHR vendor are representing their data interfaces, and we're standardizing those in a modern JSON way so your applications can interact with an API consistently over web services. And on the health system side, they can stay within whatever legacy system and their legacy standards that are being used there. So these are some kind of the standards on the bottom that you commonly see at different EHRs. Even EHRs like Athena Health, who have great API specifications, they're still only specific to Athena. And as we see the EHR market increasingly become fragmented, it's the need for that one-stop shop to connect once, connect all model has really started gaining momentum. So that's in a sense how we are able to help people with EHR integration is by standardizing these various interfaces across the different EHRs and health systems that we see out in the landscape. This is our team. We're based in Madison, Wisconsin, and literally all we do is integration. So we have partners like Kinvey who can help with the other aspects of application development, which is why we're always excited to work with them on these sorts of different projects. But most of our team met while we worked at Epic, which is why we're based in Madison, Wisconsin. Our company really started after a lot of us had that experience there of rebuilding interfaces and recreating the wheel every time we saw applications need to connect with the system. Let me move off this slide because it can get a little jarring here. So within our dashboard, this is free and open to the public. You can log in, check it out. We have documented and data models and data dictionaries that help you understand what data is available from the clinical setting in the EHR and how to get it and how to set up your application to interact with that API. We also have sample data and dev tools in there, so you can really answer that question. It's kind of a chicken or egg question of lots of health systems will ask you as a developer, can you integrate with our EHR? And the answer is probably yes, but it's hard to show that without having the EHR on the other side. And what our dev tools allow you to do is simulate, as if you had an EHR there, what messages would look like coming out of that, and show in a demo environment that you can integrate with Redox, and Redox integrates with EHRs. That's all we do. Additionally, the data that's available through that system is pretty much the entire snapshot of what's in the patient record. So it's the clinical data. It's also a lot of the transactional data around logistical information. So when patients are moved within the health system, or if something's updated in their record, we can subscribe to feeds that let you know and notify you of things happening, so you can trigger workflows based on that. Additionally, we can also write most of this back into the EHR through interfaces designed to do that. So it is definitely bidirectional, and we've to date integrated with about 3 dozen different EHR vendors in production. So we have some of the popular ones listed here on the slide, but really it's most of the EHRs that I've heard of. We've done integrations with, and we've integrated with a bunch I haven't even heard of before we set out to start doing this. So it's the commonality there is that most EHRs have some level of interfacing capabilities. They're required to, and that's what we're tapping into and standardizing across the board. And with Kinvey added to the mix, we can really help to mobilize that healthcare information platform. So I want to hand it over now to Jikku from Kinvey to talk about the other aspects of application development, and then we'll move on to questions. If you have questions about integration, like we talked about at the beginning, feel free to throw those in the GoToWebinar, and we'll address those at the end.
Okay. Yeah, thank you, Niko. This is Jikku Venkat. I head product management here at Kinvey. And you heard Niko talk a lot about the integration side of things on how do you get all these disparate electronic health record systems. How do you interface with them? How do you standardize the data coming from different system in a form that is consumable by your application? And what I'm going to talk about here is the end-to-end view of your application. So you have Redox in this picture that covers the integration between EHR healthcare systems. And what if your end application that is sitting on the left side of this picture and on the top needs a lot more than that, right? What are those things that you will need to build out a 5-star user experience, whether that's a mobile app, a web app, a chat experience for your customers, or whether it's interaction with a wearable, healthcare-related wearable device, and so on. And then what about the analytics piece? As Niko had mentioned earlier, there are many aspects to digital health, one of which is, having analytics not just for the patient, but for the payers and providers too, so they can look at outcomes. And so typically those apps are built as responsive web apps, as it's shown here. And these folks are typically looking for a dashboard that allows them to visualize all of this data, and they can look at outcomes and derive some insights. And finally, how do you assure that the entire experience end-to-end, including all of these applications, is both secure and meets any stringent security standards that you might have, as well as being compliant to HIPAA rules and regulations and controls that and safeguards related to HIPAA, or in some cases, if you're doing a wearable device or something like that, you might be involved in being compliant with FDA regulations as well. So just at a high level, right? One of the things that Kinvey does is abstract the EHR complexity from client app developers. You heard Niko talk about the integration problem. The other problem is, from an application developer's perspective, what do I need to do to access information, for example, to get the clinical summary? And what you'll hear in the next 15-20 minutes or so is how Kinvey enables you to do this in a way that, as a developer, all you're doing is writing a single line of code or a couple of few lines of code without having to understand all the intricacies of either Redox or the healthcare system that is behind Redox. And Kinvey abstracts all of that away from you as a application developer. And once again, this application that you're creating might be a web application, a mobile application, a chat experience, whatever it might be. You can work with that. So let's look at it from the perspective then of that application developer and the application experience that you're trying to create. And let's look at all of the building blocks or pieces that you will need to create a HIPAA compliant application experience. So there's several pieces that you will need, and we always take this approach of looking at things from an experience out, whereas Redox is approaching things from the EHR in, right? So it very complementary technologies working together, so you can provide the entire experience. So some of the pieces that you'll need to make up these application experiences are, first of all, as a front-end developer, you need a development environment, right? An integrated development environment and the tools that go along with that to build your app, to test your app, and so You need some way to make sure that data flows securely from your app to Redox and onto the healthcare systems, as well as data flowing to other systems that you are using in your app. For example, maybe you want to tie into a CRM system, so you're able to track a patient as a customer and have a relationship with the patient. You may want to integrate with other systems, other services that are out there that you can take advantage of. Plus, every application that you are building, whether it's a mobile app or a web app or a chat experience, or maybe even a virtual reality type experience, you're always going to, your application, when people think of applications, they think only of front-end code, but almost all applications will always have some back-end code as well, right, that are specific to the application. And that's what we call middleware services, whether these services are there for integration or for doing other things, other customizations. You'll always have back-end services. And then the other big thing you'll need to deliver an app experience is what happens after the first version of your app goes live. You still need to maintain this application, you need to update it, you need to operate it, you need to scale it as you bring on new users, you need to monitor, manage this application, provide technical support for your end users, right? And all of that is composed in the operation. This is often something that's ignored. When people think about costs of building out an application, they think of the development cost, but the cost to maintain and operate is also something you need to look at, because we always like to tell people you should look at the total cost of ownership, and sometimes the development cost is a small fraction of the total cost of ownership. So if we break all of these layers that we just spoke about down, you'll notice from an IDE perspective, you are looking at user interface and the user experience design, and you might use tools to do that. For example, Apple with Xcode has something called Storyboard that you can use to map out your user experience, or you might be using other third-party tools that enable you to build out these storyboards, so you can ensure that you're creating the right user experience for whether that be a patient type persona, a provider persona, or a payer persona. Once you have the UI UX design nailed, you need to make the choice of, am I going to use what is an RMAD tool, what a rapid mobile application development tool, or in the case of a web application, also there are rapid application development tools that are sometimes low code or zero code, where you can simply drag and drop and convert the user experience that you mocked up with a storyboarding tool into a real live application. So you need to make the decision of whether you're going to use an RMAD tool, how you're going to build the app, or are you using native hybrid, high code development tools, Xcode on the iOS side, or Android Studio on the Android side, or any other Eclipse or any other tool you're using on the website, right? And then you have to think about how you're going to build this app and then distribute it to the end user's devices. How are you going to do your user experience testing? What are you going to do about analytics, especially crash analytics and so on. And on the secure data flow side, right, you need to think about the syncing of data between the device where your application resides and the cloud or the backend systems. Do you want to provide your users with an offline experience? So what if they are offline, not connected to a data network, or data network is unavailable? Should the app behave gracefully? What type of information do you still want to display in the application? Resolving conflicts when people are accessing the app from multiple different ways, multiple different experiences. So you go on a website, you do something, you go on your mobile app, you do something else, and sometimes these two events are in conflict with one another, and in that case, how does the conflict get resolved? You change your phone number on the web app, and you made a different change on the mobile app, which is the right phone number. You have to worry about, while data is flowing between these systems, there are a lot of moving parts, and you need to ensure that the data is always encrypted while in flight between device and the cloud, between cloud and the systems of record. It always needs to be encrypted. How are you going to manage your users? Are the users going to have an identity in a CRM system, in a provider's identity provider? Like, for example, if the hospital has their own identity provider, is that where patients are going to authenticate, and is that where you deal with how you deal with user management? Decisions like this that you have to make. How are the user authentication tokens managed? Because again, remember that some of these devices that are in the patient's hand can be untrusted devices, and therefore, you may not want a hospital's authentication token persisting on these devices and being vulnerable to a hack. Abstracted API methods are very important to enable a very agile development cycle for the front end. So the front end does not have to be encumbered by delays in the back end, because the back end is a very deliberate process, and so having an abstracted API method abstracts you both from the complexity of the back end as well as the speed at which the back end works. And then moving on to middleware services, there are things like data authorization, right? Yeah, you've authenticated. Now, does the persona that you have, are they authorized to access the data that they are requesting? For a lot of these mobile experiences or web experiences that you're building, you're going to need some persistent data storage for net new things. So you get the EHR records that are persisting in the EHR systems, but what if you have net new data, your profile information, for example, for a user that you want to persist, that's net new for the application? How do you orchestrate data from multiple EHR systems, other cloud services? Same thing with auth as well, that you need to orchestrate. For example, you need to sign into the hospital as well as sign into a CRM system. How can you make that work? Contextualization, knowing that the user is accessing the application from the web versus mobile, and knowing where the user is accessing the application from, knowing that context, you can do special things. And where does the code to do those customized experiences, where does that code reside? You need some backend environment where there's no code needs to reside, right? And in the middleware layer is where you want to make sure that your users have a very high performance experience, because otherwise they're going to not use the app, they are not going to be as engaged. And a lot of what we found in our experience is a lot of these EHR systems can be very slow, because in the mobile world, people are looking for sub-second response times, right? And so you want to be able to cache and or sync data. You want a place to put files like pictures you might take, images, things like that. And you may want middleware service to take this data from an analytics perspective to offload it or to upload it to a data warehouse or some other analytics system that you have in place that gives you a 360-degree view of the patient with data from multiple different sources. Where does that service run? And then in the operations side of things, you want to be able to, again, like I said earlier, monitor all these services, monitor all the back-end code, all the synchronization that is happening, be able to scale it based on load, based on users signing up and using the system. You want to be able to scale up and down rather than have static capacity that is, can be over-provisioned and therefore cost a lot. Once your app goes live and your users, whether they are patients or providers or payers calling in with issues, how can you enable troubleshooting, diagnosis, and speedy resolution of problems? This, troubleshooting is useful for a tech support staff that wants to diagnose and resolve a problem, as well as your development staff that says, okay, user encountered a problem, how can I quickly understand root cause and apply a fix and verify the fix before I roll it out. And from a security and compliance perspective, you want to have an end-to-end view of everything to ensure that the app is compliant and secure. And part of being secure is make sure that the software is always updated, so there's a maintenance that needs to happen. For example, security vulnerabilities are constantly resolved with patches that you want to roll out, so you need to be on top of that. And then finally, this is again something that people take for granted or spend enormous amount of time and money setting up, is the infrastructure. The infrastructure to run all of this. In some organizations, we found that it can take a long time and be a bottleneck just to set up and get the infrastructure going. And so you want to make, with the cloud environment, you simply get that. So what Kinvey's platform provides is everything in orange here, right? So all of the pieces under the secure data flow, everything on the middleware services, obviously the data integration piece, part of that comes from our partnership with Redox, as Niko mentioned here. All of the operations for that data integration is also coming from Redox. But everything else that you're doing, all the other miles you have to cover, from integration to providing a 5-star user experience, is what Kinvey provides. And it's also important to note here, what we don't provide, right? So we have you bring your own IDE to the table. Whatever you're comfortable with, whatever your front-end team has the skills to do, you can bring in and use with Kinvey. We do not want to lock you in to using a specific IDE, a specific language or framework of our choice. The choice is yours. And we believe in that openness and that flexibility to allow you to bring whatever you want. Again, we do understand that skill set, finding the right dev skill sets is at a premium, and so whatever skill set you can find, if they are JavaScript developers and they want to develop the app in JavaScript, they can do that. They don't have to learn something new. If they are developing with native iOS, great. Native Android, great. We'll support all of these front-end languages and JavaScript frameworks and so on. So again, everything in orange is what Kinvey provides, and that's a lot of miles to cover going from integration to the 5-star user experience. So this type of platform, there are a lot of people doing this obviously out there. Kinvey is one of them, but we are very proud to note here that Forrester did an analysis, they call it the wave, late last year of us along with many of our competitors, and they rated us as the #1 platform in terms of our current offering, and we showed up definitely in the leaders right at the top for our current offering. And most importantly was the feedback that Forrester cited from our customers, right? And that our customers, spoke very highly of us, regarded us as a partner, not a vendor. And we always believe in focusing on the developers. This is a product that is built by developers for developers, so an outstanding developer experience is something that is very key to everything that we do. So with Kinvey and Redox together, you can be an innovator because you don't have to be encumbered with the complexity of the EHR systems in the back in your back office in your data centers. You can really innovate on the experience side and bring ideas to market very quickly while still retaining all of the security and compliance. You can keep your users very engaged because you can build, again, these feature-rich apps with analytics, with push notifications, things like that, maintain high levels of user engagement, and finally, obviously, as Niko said, the real objective here is to realize better outcomes for your stakeholders. And we do this by creating these experiences and this engagement with your target personas. So that's all we had at this time, and I wanted to quickly pause here for questions.
Yeah, thank you everyone who put some questions in there. You can keep doing it, and we'll take a look and see how much time we have, and we'll try to get to as many as we can. The first one's for Niko. What does a health system implementation look like, and how long does it take?
Yeah, that's a great question. So Redox is currently implemented at about 100 health systems across the country. So if we're already in that health system that you're working with, implementations can be very quick. Our fastest we've done it is 48 hours, where we turn on your interfaces and staging, and then we go through workflow testing, and if it looks good, move it into production and go live the next day. That's on the, obviously on the very fast side. Typically, if we're already live at the health system, we're looking at about a week to get through the testing time period and making sure all the interfaces are working correctly, and making sure if we're sending data back in, especially, that it's going to the right space in the EHR and in the provider's workflow in the right area. If we're not already live at that health system, that's totally fine. That's that's how Redox got into those 100 health systems that we're in right now, is by working with health systems that were brought to us by vendors out there who are creating innovations and selling it to those health systems. So those implementations, they're a little bit bigger of a project. They take about 3 to 6 weeks depending on the scope, and Redox doesn't charge for the implementation to set up the connection to the health system. We will do the technical project management, work with the IT teams, their interface team, their network team, and their EHR teams to make sure that we're getting the right data at the right time and putting it back in. So we manage that process. It starts with connectivity. We go into configuration of the API based on their interfaces. We do testing in a staging environment, and then move that into production, watch it in production for a little bit, because oftentimes we see differences in an EHR production versus staging, and then we do end user go live after that. So that process is what goes on over that couple-week time period. Yeah, but that's a kind of an overview of the implementation of how, working with the health systems.
Great, thanks, Niko. So the next question is for the both of you. Do Redox and Kinvey do any caching or information store from the EHR, and what's the performance impact, of using Redox versus going directly to the EHR?
I can take that one first. Go ahead, Niko.
Yeah, the second part of that question was definitely kind of on our side. So we cache data for 48 hours. So we're not a data store, we're not a repository, but we're caching it simply for troubleshooting purposes. So if the endpoint goes down and we need to re-trigger messages, we have those at least in a bit of a stockpile, so we can make sure that we don't have any data losses. If a interface goes down, and most interface. That's kind of standard practice to keep them around for a little bit before sending them onward. We are starting to do some more REST-based API and web service bundling, which does require us to store data at a more long-term basis to provide kind of a historical view of certain types of data. But that's things that we broach at the health system level based on the scope of your project. We've seen 90% of the time that we're able to do this without holding on to a large chunk of data. From a performance standpoint, most of our messages the average message processing time is about 100 milliseconds from the trigger, from the action in the EHR going through our engine, being parsed and translated and being posted to a callback URL endpoint, and vice versa. So it's meant to be real time, where we're supporting applications today that are used in the operating room, that are literally patient on the table, life or death situations, and so stability and performance are of utmost concern for us. So it's something we obsess over. And when we started, it was definitely slower. Our first few implementations were slower, but the optimization we've done over time has gotten that a lot faster. And doing it yourself, you'd probably end up right about the same, right? You're still processing data, you're still translating it, putting it into your schema, into your database. The only thing that we're doing is centralizing that process, focusing on it, and becoming really good at it. So our specialization there will hopefully help us do that faster and better for you than if you did it yourself. I'm not saying you can't do it yourself. It's just a bit of a lift and a bit of a specialized activity.
And just to add to what Niko said with respect to caching and persistent store with Kinvey, in addition to everything Niko said that Redox does, we can, within Kinvey, you can also cache the data temporarily. So you have another layer of caching in the Kinvey cloud, and you have flexibility over the TTL, or the time to live of that data. So you can configure that to be what you want, whether you want to keep it for 48 hours, less, more. That's configurable on the Kinvey side, all the way down to you can also configure the data to be cached on the device side, and you may choose to do that for certain types of data and not for others, and so we give you a lot of granular control over that. In terms of persistent storage, yes, we do have a persistent store, like I said, for net new data that your app might need. We also see some cases where our customers want to, rather than going real time to the EHR, they want to synchronize the data at some interval, right? Every 5 times a day or every hour or something like that. They want to sync the data between the EHR system and Kinvey, and use Kinvey as a persistence layer again, but not the system of truth. It's still synchronized with the eventual system of truth, which is the system of record that's on the other side. But you can do both caching and syncing of data with Kinvey.
Great, thank you. And one more question. What's the true value of working with Kinvey and Redox together on a project?
I can take this one, Niko, and then you can add to this. So, like I said in the presentation, what Redox gives you is greatly simplifies a very hard problem, which is the integration to these EHR systems, which can be very complex, use many different data formats and protocols, making the developer's life extremely difficult. And so Redox does the hard job of the integration and, if I can use the term, normalization of the data. And with Kinvey, you are getting all of the other miles that you need to travel to get to the actual application experience. Things like being completely abstracted to the EHR, being able to store data, cache data offline, provide an offline experience for your users, having persistent data store for net new data, having caching and syncing of data, like I said earlier, at various levels, and all of the operations, the monitoring, the scaling, basically everything I highlighted in orange in that picture of looking at things from an app going out, all of those things are what Kinvey provides. So it's still significant, and in terms of time and cost savings, it can be very significant, and we do have a calculator on our website that you're free to use to understand exactly how much you save in terms of both time and cost.
And if I could just add, the way that I think about it is, Kinvey is your expert in the infrastructure around developing applications for healthcare. Redox is a small piece of that, and our focus is on the clinical workflows and how your application will impact clinical workflows for a provider or nurse or care teams or patients, whoever's actually on the other end of that, either using the application administered through an EHR or using the data that's created or the insights created from your application in their EHR workflow. So we're experts in figuring out how and when this should impact and become involved in the provider's workflow, and do it in a way that is scalable across many different EHR systems at different types of health systems across the country.
Great, thanks, Niko. All right, so we can take one more. Let's see, there's another one here for Niko. Let's see, so apart from the integration, do you have to work separately with the EHRs if you want to have a bidirectional data exchange to push data back to the EHR?
Yeah, that's a great question, and unfortunately, it's not a simple answer. It depends a lot on how the EHR is deployed. There are certain EHR vendors that are cloud-based, like Athena and Dr. Chrono, for instance, who, because it's cloud-based, centralized, multi-tenant infrastructure, you actually do have to work with the EHR vendor directly to get access to the interfaces to bidirectionally integrate. And fortunately, we've had great relationships with both of those vendors as well as many other multi-tenant kind of cloud-based EHR vendor systems. However, the majority of EHRs are kind of legacy on-premise systems that live in the infrastructure managed by the health system or provider practice. And for the most part with those, the health system's IT team has full control over the ins and outs over that interface layer that comes with those EHRs. So for Epic and Cerner and Meditech and McKesson and those sorts of legacy EHR systems, we're able to do bidirectional integration with those without needing to talk to the actual EHR vendor themselves, where we can do that directly with a health system with their IT resources without burdening their IT resources, but essentially we have them grant access to interfaces for us, and we're able to do all the work there. Additionally, we do that in a way that doesn't make Epic or Cerner or these guys upset about how we're doing interfacing. We stay above board and within the unwritten rules of how to do these integrations in a way that don't cause patient safety concerns. And that's really kind of the big concern with pulling data out or sending data back into the EHR, is that we don't want to do anything that will adversely affect the workflow or patient care itself. So we're very sensitive to that, but it's a really good question because it does depend a bit on the particular EHR vendor we're talking about.
Thanks, Niko. The next one's for Jikku. What was the criteria used by Forrester when they looked at Kinvey and our competitors?
Yeah, so that's also a great question. The quick answer I'll give you is you can go to our website and download the entire paper that has entire report that has all of the criteria. So I would strongly encourage you to do that, because there are literally over about 150 different criteria that they judge us on. It's broken down in terms of back end, or what they call an API platform, the front end, the analytics, as well as the operation pieces. So those are the categories. But again, there's over 100 different criteria, so strongly encourage you to go to our website so you can download the entire report.
Excellent. All right, I think we can wrap it up there. And like I said, this whole recording will be sent out tomorrow, so you can listen to the whole thing, and you can follow up with us at sales@kinvey.com, and if you have further questions, and we'll also be forwarding along Niko's information as well. Thank you.
Thank you.
Thanks, guys.